We then set about conducting these real-time audits. And in September, early September, we issued a report. The AG Magwetu issued that report. And in the time that has elapsed since then, we've been hard at work to complete the second installment of this report. He promised back in September that we would issue this report in November, at the end of November, before he left office. And sadly, he passed away a few weeks before then. So we stand here as an office fulfilling the promise that AG Magwetu made to South Africans back then. Just another reminder that we're looking at the 500 billion rand package, the fiscal relief package, which covered the health response, the social and economic relief response by government. We don't look at every single rand in that package. As you know, some of it was about guarantees that were being dealt with through a partnership with the commercial banks. Some of it related to relief from SARS, different initiatives. So we're looking only at a component of the initiatives, and we've looked at 16 initiatives. The very same ones we reported on back in September are the ones that we followed up on and are sharing some input on today. For a reconciliation of the 148 billion rand that has been subjected to real-time audits by the Office of the AG, please refer to our report. From pages 19 to 22, we have a full recon of the specific items that have been subjected to this review. As at the end of September, out of the 148 billion rand, 95.8 billion rand had already been spent, 65%. And we are reporting on our review of the accounting records related to that level of expenditure. May I just check how I move this set of slides, Africa? Okay, got it. Thank you. Okay, great. Thank you. Just a reminder of how we've approached this work. We started, just a reminder of how we've approached this work. We started back in May with engaging with accounting officers to talk to them about the preventative controls that needed to be in place if they were to have some assurance that the initiatives were being rolled out in a manner that's consistent with key principles of accountability and transparency, and indeed that they were going to safeguard resources and channel them towards their intended initiatives. At that time, we identified key areas of risk. We identified high-risk transactions, and this we did through detailed data analytics that were compiled by a multidisciplinary team that we deployed to look at these initiatives. So not only were our auditors deployed, the financial auditors that you are used to interacting with, but we included in their teams the input of engineers, the input of other sector specialists, as well as information systems auditors, fraud detection risk specialists as well. We then set about auditing particular transactions and looking to detect whether the key controls were in place, and where they were not in place, what level of loss or non-compliance may be evident. And then we've been reporting on that. So in the second installment of this report, we followed the very same course. We've taken the preventative controls that we spoke about in the initial instance, and we've gone about looking at the transactions that were put through the accounting records, and we've identified certain findings and observations that we've shared with accounting officers as well as executive authorities throughout the different institutions of government. You'll know that much of this work was done during lockdown, and we've had to depend on the cooperation of different players, not just those of our teams who are particularly resilient, but also the cooperation of accounting officers as well as the teams they lead in the different institutions that we audited. Our findings, which you'll be familiar with, relate to matters of non-compliance. Just want to go back. Matters of non-compliance, or areas of misstatements, or areas of understatements, or areas of misstatement of performance information, things that would end up in the audit report. Our observations are really highlighting areas of risk and highlighting red flags of things that could potentially go wrong, and inspiring, we hope, our accounting officers to do the necessary to fix the internal control environment and avoid non-compliance, avoid misstatement, and avoid the leakage of funds. In our first report, you recall that we talked about a few items that we were concerned about. We raised at that time that the pre-existing deficiencies in how supply chain is managed, how procurement is managed in the state, were going to compromise the implementation of the different programs. And indeed, we highlighted that we were already starting to see non-compliance in the course of procuring goods and services related to these initiatives. We talked about the poor record keeping, which remained a common feature in many of the environments that we audited. And this was of particular concern because we were auditing real time. We were auditing within 60 days or 90 days of transactions being put through the accounting records, and we were still struggling to find documentation to support key transactions. And this indicating that come the year end, the ability to produce credible financial information, reliable performance information, and to demonstrate that compliance has been a feature in how public funds were spent, that evidence would be difficult to find. We highlighted then that there was a pre-existing inability to coordinate and manage different initiatives across different institutions of government in a way that was cohesive, in a way that was adequately monitored and overseen, so that that which is designed is what is consistent with what is ultimately implemented. At that time, we also talked about how our review of different transactions across different data sets of government highlighted that there was a need to maintain databases even better and to integrate databases even better, so that again, the initiative as designed is consistent with what it is that is implemented. So if you have a database at the Department of Home Affairs, there's a comparison between that and what UIF uses to implement their designated initiative. Similarly for SASSA. So our findings, our observations, and our red flags were informed by us having looked across the different databases and raising this flag about the need for quality databases that are appropriately integrated throughout different institutions of state. At that time, we also talked about the need for greater agility in the technology, in the information technology systems that are being used in different government departments. So in many ways, what we said at the end of the first report, we said that these initiatives landed in an environment of compromised internal controls. And if we do not fix those internal controls, it is likely that the initiatives would not result in the benefit as intended. Back in April, we started by conducting audit work for 2 months. We then reported our findings and observations to accounting officers. We also shared those observations and findings with executive authorities through different engagements, and we gave an opportunity for accounting officers to respond to those findings and observations. We also shared the outcome of our work with the Fusion Center, which has different agencies in the law enforcement arena engaged in a collaborative effort to safeguard resources, to collect resources that would have leaked inappropriately, and to implement the appropriate levels of consequence management. And we also engaged with some of the oversight structures in Parliament. Our second report similarly covers the period up to the end of October. So we're reporting now at the beginning of December on transactions that would have gone through the accounting records up to the end of October. Some of them September, but many of them in October. So this is real time. These financial records are what we are going to audit in terms of the annual regularity audit next year. So these are accounting records that relate to financial statements that will be submitted to the Office of the Auditor-General on the 31st of May next year, and we will audit those. At that point, we will look at these findings and observations and consider them for our own final audit conclusion and audit report in the normal course. We've also used this time to engage with accounting officers, share with them our findings, our observations, as well as our recommendations. And we've also engaged with all of the executive authorities responsible for each of these initiatives. We're currently hard at work on our third installment of the report, which will look at local government. So this report that we're tabling today does not include local government as a focus area. That will be dealt with in the next installment, which we will issue during the course of next year. Our collaboration with the Fusion Center will continue as we have begun. The different initiatives that we've looked at cover social and economic relief packages, and just to give you a sense of some of them. So you recall that SASSA spent 31 billion rand already. Up to the end of September, they spent 31 billion rand delivering different benefits to vulnerable households throughout communities of South Africa. 5.26 million people benefited from the special relief grant. 11.8 million South Africans and their families benefited from the top-up grants, and a number of families benefited from these food parcels. So our report starts off with this recognition of this big effort made by government to deliver social and economic relief and to deliver a health response in a space of an emergency, in the context of an emergency. If you look at the wage protection effort, the work by the UIF to deliver claims for temporary employment relief to 11 million South Africans operating in different parts of the economy, spending over 43 billion rand of the funds at UIF to deliver this relief to people when they needed it most. And I think a similar profile of different initiatives that have been run by different institutions of state to deliver benefits to the most vulnerable at the time that it was needed. Farmers Relief Fund benefiting many farmers, many small-scale farmers through the delivery of vouchers across different parts of the country. The Sports, Arts and Culture Social Relief Fund also benefited over 4,000 artists, artists, athletes and technical support persons in that sphere who needed that support at that time. I'm going to skip much of this and talk about the different programs in the context of the actual findings of the report, because I think that's where many members of society are particularly interested. What I do not want us to lose sight of, though, is the notion that many of these initiatives were designed and implemented very quickly, and they were designed and implemented in a space of an emergency where not everybody was at their desks, and they were still able to reach many beneficiaries across the system. What we are highlighting, which is probably the biggest headline of this conversation today, is that but for the weaknesses that were inherent in the systems, in the processes, in the disciplines, but for those weaknesses, we could have achieved much more with the investment that was put in place. All of these initiatives could have run better were there better controls in different parts of government. We could have reached much more people, much more quickly, and in a much more efficient way. It doesn't mean that 8,000 tanks were not delivered. They were delivered at a time of crisis, at the time that they needed it most. But if our processes were better, we could have gotten much more out of this major effort. We report in detail on many initiatives, save for a few that I'll just highlight now. We don't have too much detail on the support to small business because there's not really too much to say, and the detail is in the report. There isn't a big chapter on it. The temporary residential units, some amongst you might know that program was abandoned. So it started off and it became quite clear that the coordination across the different spheres of government wasn't at the appropriate level, and as a result, that program was abandoned and the funds were to be allocated to the normal program of providing residential units through the different initiatives of the human settlements portfolio. We don't provide too much detail on the loans provided by the Industrial Development Corporation, save to note that following the first report, where we highlighted that the 2.5 billion rand that had been allocated to the IDC, which was meant to fund different businesses that would have struggled to remain afloat because of COVID-19, that those funds had not been dispersed, that there had been little movement in approving the different applications by various businesses. We highlight in our report that we've seen some progress. There have been a few applications that have gone through the system, and a small amount of disbursements that have reached different companies. And as I said, we're not reporting on municipalities this time around. We will report on those in a subsequent edition. Our previous message that said that the risks associated with a rapid implementation within a compromised control environment, that message remains relevant today. And we talk about how the impact on the effectiveness of initiatives is now becoming apparent. The effectiveness of our initiatives is compromised because we do not have stable disciplines and controls in government. Some of our initiatives did not achieve the success that they should have because we don't have appropriate levels of discipline in planning, in monitoring, and in coordinating the effort of different players across the state. And we do believe that what we're learning from this crisis is that we need much more collaboration than not. The effort that we would have seen in the water sector, where the department, the national department, worked with Rand Water, that was appointed as an implementing agent, as well as the municipalities within which different communities reside. That program reached a number of communities where they were able to get tanks, water tanks delivered to them. However, some of the weaknesses around coordination, cohesion, monitoring, oversight, those weaknesses are the things that would have resulted in less success than what we would have had. We also talk about how when we appoint implementing agents, be it Rand Water, such as Rand Water, which is a state institution, or other institutions outside of the state, when we appoint implementing agents, we have to work much harder to develop and implement the disciplines of monitoring, the disciplines of being clear about roles, and the disciplines of overseeing the different programs, so that ultimately an initiative that is designed to operate across different institutions and relies on effective collaboration, that program will succeed if we are diligent in developing and implementing the controls that will support coordination, cohesion, and monitoring. On PPE, in particular, as well as generally procurement, that remains an issue, that remains a challenge in government. And the stories around PPE procurement and the procurement of medical equipment, those stories we locate in the context where there is poor discipline around procurement. There are weak systems to support procurement that is fair, that is equitable, that is transparent, and that delivers cost-effective, quality goods and services at the appropriate time. We've highlighted that there are inadequate controls over the payment for goods and services, and inadequate controls to ensure that we pay only for things that are delivered to us at the right quality, at the right price, and at the right location as we would have it be. We've also observed that we do not see adequate care being put in place to protect us against overpricing, against financial loss, and instances of fraud and abuse of the system. So when we talk about the different findings and observations across these initiatives, we've analyzed it and we locate it all in the context where there is poor discipline and there is poor systems of managing procurement across government. We once again raise concerns about IT controls, that the IT systems in government are not agile enough. Our processes and controls are not designed so that we can adjust them to respond to the initiatives that we've designed so that we can be sure that that which we've designed is ultimately what manifests at the implementation phase. We've raised a number of findings around validation controls, the integration and sharing of data sets across government platforms. So again, similar issues as we raised in the first report. And we've highlighted that there's an urgent need to address the legacy issues around public sector information and communication technology. And one of the pleasing things is that when we shared some of these reports, some of our findings and observations with government, we've been given feedback that the Directors General of different departments across the state are working collaboratively at the center of government, coordinated by the Department of Planning, Monitoring and Evaluation, to deal with this issue around maintaining appropriate quality data sets and driving effective integration of data sets across government. Some of our overall findings demonstrate that where there is responsiveness following the audit by the Auditor-General, we do see some benefit. And here's an example. At the end of the first report, we shared with the executive authority responsible for the UIF, that being the Minister for Labour and Employment. And we shared with him, as well as the DG in the department, our key findings and observations and our key concerns. And we shared with them those observations relating to inappropriate payments to people who should not have benefited from this TERS benefit. We shared with them our concerns around payments to people who had claimed for people that were not employed. We shared with them our concerns about payments to people who were getting benefits elsewhere. Payments to people who were in prison. I think some of you might recall that. And when we shared those findings, what was pleasing is that there was some responsiveness. You may recall that the very same afternoon that AG Magwetu tabled his report, the Minister of Labour and Employment had a press conference the same afternoon, wherein he informed the public about key actions taken to address the findings raised by the Auditor-General. What that has done is threefold. One is that the subsequent transactions following our audit, our recommendation, and the implementation of corrective action, the subsequent transactions look a lot better than the first phase. So the exceptions are still there. Things are not perfect yet, but much fewer exceptions. That's the first thing. The second thing we found is that there were consequences meted out to people who had performed poorly and had maintained systems that resulted in that level of loss to the UIF. And the third aspect, which is also important, is that there was a diligent effort to recover what had been paid inappropriately. So as we speak now, 3.4 billion rand has gone back to the coffers of the UIF because there was responsiveness. And I think if we embrace this crisis as an opportunity to learn, an opportunity to galvanize our efforts to deal with the urgent need to strengthen our systems in government, we can win. And this example provides an area of inspiration for us as an office, because our work clearly matters and is being taken seriously, and it is having the impact we had desired. Because we do this work so that we can provide value-adding insights, timely, relevant insights that help those that are charged with running government to do so even better. We've seen that there are more controls still to be placed so that we eliminate the exceptions that were there in the first instance, whether it be paying people who continue to benefit from NSFAS, people who benefit from SASSA, and people who are non-South African residents. And our point is not that you shouldn't be paying these people, but rather to ask the question, we notice that you're paying these people. Is this consistent with what you want? Because if it is, well and good. If it isn't, let's attend to fixing the processes so that the benefit reaches the people that it is intended for. And we've also noticed that there is much greater effort towards post-validation processes, so that where there have been rejections, they are going back to look at those and validate that they were appropriate. If they were not, they are paying back the people that should have gotten the benefit. And similarly, they are continuing to audit the payments that have been made so that they can recover funds from people who got the money inappropriately. In the context of SASSA, following our first report, there was a stop to some of these payments and a review of the systems and the processes that underpin these grants. And what is pleasing to note is that following the first report, yes, we still have some exceptions, but we're seeing much fewer exceptions than the first time round. So a similar story to what we saw in the UIF. In the first report, we had raised key concerns about invalid rejections, where applicants had made an application for this benefit and had been rejected. The leadership at SASSA has now gone back to relook at those rejections. And where the application was valid, they've gone back and paid that application. And where it remains invalid, it has remained so and confirmed as such. They've also gone about ensuring that they are investigating the things we've raised, whether it is people who are employed elsewhere or are getting government contracts. We still see that. Over 1,500 claimants of SASSA grants happen to be directors of companies that benefit from state contracts, which is a matter that requires further investigation and hopefully recovery from people who benefited inappropriately. The beneficiaries that we have identified as having benefited inappropriately are just over 67,000, which represents less than 1% of the approved applications for this SASSA benefit. And I'm trusting that this gives you a context and some perspective about the nature and the extent of the exceptions that we have found, having examined through the use of experts the entire database of payments made to different applications. On the top-up grants, following our first report, the manual controls or the manual processes that were making it difficult to avoid underpayments and overpayments, those are being addressed, and we're seeing fewer exceptions than what we saw before. Again, it is not to say that we are done with the work of fixing controls, but it is saying that where there is responsiveness, we do get the benefit around safeguarding resources and demonstrating that people that should benefit from these programs are indeed the ones who do. On the Farmers Relief one, following our first report, there were the rejections that were now re-evaluated and reconsidered, either confirmed as people who should not benefit or paid where they should have benefited in the first instance. Similar profile here, where there was responsiveness. The work is not done, but the processes are being tightened and strengthened so that indeed the next lot of relief programs that are being designed land on a system that is improving. So we need to maintain the momentum of responding to audit findings and actively fixing the weaknesses in government. In the Tourism Relief Fund, over 4,000 tourism businesses benefited from this relief fund. The full 200 million that had been allocated was paid out. We found that there were instances where supporting documentation was not adequate. And we've raised this with the accounting officer, and we believe that they will indeed address these weaknesses so that when we come for the year-end audit, that documentation is in place. What that will do is it will not only demonstrate a willingness and a capacity to respond to the things we've raised, but it highlights an improving commitment to fixing the controls that must underpin improved transparency and accountability. At sports, the major issue that troubled us in the first report is that the department was quite slow in processing the applications and did not make key payments to people quickly as what was the need. And that's, again, an issue about the agility of our IT systems and the strength of our internal control environment. Subsequent to our report, there have been many more payments made. However, had there been better controls, we could have reached more intended beneficiaries much more quickly. There are still some weaknesses around payments to people that should not get the benefit. We found that there were 286 beneficiaries that needed to be investigated to confirm whether or not they should have received that benefit. From what we saw, it looked like they should not have, either because they were employed somewhere else or they were getting a benefit from somewhere else. And that needed an investigation and a conclusion to be made by the accounting officer. In the processes of procuring the digital solution service and the appointment of payment agencies that worked collaboratively with the department, we found that there were weaknesses in those processes. And again, it's really in the space of saying our disciplines around managing procurement need to be strengthened. On the food parcels, similar issues around planning, record keeping, and guidelines that needed to be put in place so that the process of issuing these food parcels is consistent and has a consistent experience in different parts of the country. We've raised these findings with the department, and we hope that they will get the attention that they deserve. A little bit of detail on PPE, because in the first report we did not deal much with PPE. At that time, we were still processing a number of our audit tests, and so we did not deal too much with it then. We're in a position to share with you some of the insights that we've derived having audited PPE procurement in both the health sector and the basic education sectors. Some of the PPE procurement processes were run through the departments of health in the provinces. Some were run through the Department of Basic Education. Some were run by the Provincial Treasury, as was the case in the Free State. But we've looked at all of them, and we've summarized our findings on each of those areas. Our report has a summary on page 90 that will give you a feel for where we had these findings, which provinces had a prevalence of findings. I'm just going to highlight just the key observations and the summary of what it is we found. We've highlighted that competitive processes were not followed, such that some of the contracts were issued to suppliers that should not have got those awards. And there were deviations that were not approved at the appropriate level. We noticed and had findings in different areas that the requirement that was established by the National Treasury for some aspects of PPE to have local content in them, those were not always observed. And we also found that the tax affairs of some of the suppliers that benefited from these contracts were not in order. That is against the law, in that anybody who gets a government contract should have their tax affairs in order. In fact, there's a requirement that you have a tax clearance certificate. And of course, it falls foul of the notion that government must get the taxes that it should collect. We found that the processes of procurement were not always fair, and they were not always treating the different bidders in a fair and equal manner. So some were penalized for local government and others were not. Some were penalized for not having their tax affairs in order and others were not, which compromises the confidence that those who want to supply goods and services to government must have in the procurement systems. We found instances in many provinces of prices that were paid for PPE that were higher than the market prices that were determined by the National Treasury. And in that summary on page 90, you'll be able to see which provinces that applied to. We also highlighted that some of the PPE that was delivered did not meet the required specifications. We also found that in some provinces, payments were made to suppliers, even though they did not submit or did not deliver PPE at the right quality, and they either under-delivered or delivered late, and yet they were paid. We also found instances of poor contract management and significant deficiencies in the process of planning, of ordering, of delivering, and of paying for these goods and services. So often when we talk about internal controls, it can sound like an irritation because people ask, why would this be important? And I think an emergency such as this, a large-scale effort to procure urgent goods and services at that critical time, shows up the weaknesses that prevail. And we are reminding accounting officers of the need to use this experience as inspiration to strengthen their processes. In the storage and distribution of PPE, we found that there were weaknesses, and again, it's basic disciplines about how do you manage stock that you've got? How do you make sure that it is placed in an environment that's consistent with the requirements of maintaining the quality of that PPE? And how do you make sure that that which you have procured is safeguarded against theft and loss, and ultimately is able to be used for what it is intended for? On water, in water, we looked at the program run by the department together with Rand Water, as well as the program run by DBE, and who had also appointed Rand Water as an implementing agent. Some of our findings relate to disciplines about how do you plan for distributing these water tanks? How do you identify which communities need a water tank and which ones are okay? How do you figure out which school needs a water tank and which one doesn't? And so our weaknesses that we've identified are about those things. Do we make sure that we plan appropriately? Do we have the right information to know where a water tank is needed and where it is not? Do we know to whom a water tank actually belongs at any given time? Do we know how to manage the water tankering service providers so that we can monitor their activities and be sure that they are delivering water to the right school, to the right community, at the time that they are designed to do so? Because at the end of the day, those water tanks are meant to deliver a service. And with this big effort of getting 8,000 water tanks to communities across South Africa, the weaknesses that trip us are those of disciplines around ensuring that we know where the tanks are going, we know who's responsible for the installation problems that might arise, and we know when they need to be filled so that communities get the water that we are investing in providing to them. So without going too much of the detail, our big point is this. It is these basic disciplines that let us down. And an emergency such as this points that out. I beg your pardon. On the quarantine sites, when the initiatives were designed, there was an effort or a plan to deliver over 6,000 quarantine sites. And as the spread of COVID-19 developed, it turned out that they were not as required as what had been originally thought. I suppose that happens when we are planning in the midst of immense uncertainty. So at the end of September, we were able to audit that 192 quarantine sites had been completed and had been activated. What we found in our review of these initiatives were weaknesses around the approval and the payment cycles made for the quarantine sites and the providers there. Some of the findings related to some of the hotels overcharging us, such that overpayments were being made beyond what had been planned for and contracted for. And there was a lack of coordination amongst the different players, players in public works and players in the health sector, so that we would get the best value for the money that was being spent. And I would urge us to locate that in the same point we made earlier on about the inadequate monitoring, the inadequate disciplines around coordination when we run big efforts through different parts of the state. On field hospitals, our findings related to procurement processes that were not always competitive in the way that they should be, and the overpayment for goods and services that were either not received or received outside of a contract. And we also found that there were delays in the completion of the projects. So on the field hospitals, the major observation and the major concern is about procurement processes and about contract management processes that are weak. On the expanded public works program, over 18,000 beneficiaries of this program were deployed across different communities to drive the awareness and education program around COVID-19 and to drive testing in the different communities. There was work done through the non-profit organizations that had been employed to do this work on behalf of the Department of Public Works and Infrastructure, as well as on behalf of the Independent Development Trust. Again, we found weaknesses relating to coordination, to monitoring, to oversight, in that some of the applicants got their money late. Some of the participants got their money late, if at all. Some of them didn't have the appropriate levels of training to prepare them for the work that had to be done. And worryingly, some of them did not even have the PPE that they required to keep them safe as they were operating on this program. Again, these are disciplines about procurement and about contract management, about coordination and about overseeing and about monitoring. On the Department of Defense, we audited a number of their initiatives relating to COVID-19. Some of it were about the repatriation of South Africans out of Wuhan. Some of it related to the procurement of the drug from Cuba, and that's something that's been widely reported on. We found that there were shortcomings in planning, in procurement, in the transportation and warehousing of this drug. And we were also concerned that the drug was procured without the relevant registration and regulations being observed. We've raised these findings with the accounting officer and the minister, and they have undertaken to conduct an investigation so that they can identify where there may be areas of wrongdoing. We also found that there were inadequate levels of planning, inadequate levels of discipline in how we procure PPE and medical equipment. And we've raised concerns about the manual processes that were being used to manage PPE, to distribute it appropriately and to account for it appropriately, which compromises not just the delivery of these critical goods at the time that they are needed, but also compromises transparency, accountability, and the safeguarding of resources. So as I head towards a conclusion, our report provides you with a detailed account of what we've seen, having deployed a multidisciplinary team across South Africa. We have audited in real time and are providing timely insight on how the journey of implementing this big fiscal relief package, which covered a health response, a social relief response, and an economic relief response. We're covering how that journey was undertaken. What we are concluding is that in any endeavor, it's so important that all the players share a common goal, that they understand and respect the roles that they must play, and that they diligently execute their responsibilities, that they abide by the applicable rules and show full accountability for their part. When he issued the first report the late A.G. Magwetu talked about how in an emergency, transparency and accountability should not take a backseat. We think that indeed, in an emergency, this is when accountability and transparency should be foremost in our minds. We cannot put it on the backseat. We need to use this crisis and the response that we've seen as an opportunity for us to learn and to take urgent action to fix the systems on which public finances are run, be it around the disciplines of planning, the disciplines of procurement, the disciplines of monitoring the contracts that we issue to different players that operate within the state. The moment has provided an opportunity for us to benefit from collaboration, from innovation of different players. We need to put in place the disciplines that give us the best benefit associated with that level of innovation and of collaboration. We accept that some of the fixes will not happen quickly. Some of the solutions to the matters we're raising will take time and they will take resources. However, this moment reminds us and inspires us to take the action that we must, which is to design and set about implementing even the longer range projects that are going to deliver much greater efficiency in government, much better economy in how we spend resources, and much better effectiveness of our programs. As we head towards next year, we will be compiling our third report, which will have a focus on local government. And we will also continue to audit the implementation of the different COVID-related initiatives. We will continue to audit the accounting records insofar as COVID-related funds are being spent. And we will follow up on the progress being made in dealing with the findings and observations that we've issued. Towards the end of the year, of the financial year, accounting officers will be compiling their financial statements, their performance information, and submitting that to us for audit. So on the 31st of May, we'll set about conducting the normal regularity audit. At that time, we will take into account all that we've seen through this real-time audit, and we will complete our regularity audit and consider the impact of these findings, of these observations, as we make our audit conclusions. Some of those conclusions will be about the material irregularities. So where there are transactions we've identified now, and we find that at the end of our year-end audit, they present us with potential material irregularities that we must then follow up in the course as defined in the Public Audit Act that's been amended, as well as the regulations that support it. We will then take the appropriate action as is expected of us. Ladies and gentlemen, I thank you for giving us this opportunity to share the work that's been done by our office. And I want to use the time to also thank the colleagues that I work with at the Office of the AG for responding to the task that AG Magwetu gave us and for working so hard to deliver this report at this time. And I wish every single one of us well as we prepare to take a break, a year-end break, and I wish safety to all of us, especially given the need to manage and contain the spread of COVID-19. Thank you very much.